carriers of hepatitis B, most are asymptomatic. So if you don't check, you won't know if you have hepatitis B. Hello everyone, I'm Dr. Liu Yuzhi. Let's welcome Dr. Huang Jee-Fu to the Care Online. Hello everyone, I'm Dr. Huang Jee-Fu. What is acute hepatitis B? Acute hepatitis B generally refers to who have not had hepatitis B before and have some acute hepatitis-related symptoms after hepatitis B virus infection, such as tiredness, fatigue, and even jaundice or tea-colored urine. Symptoms of these various acute hepatitis we will estimate clinically, then go for a diagnosis. So if it is caused by the hepatitis B virus, generally this acute hepatitis B is not much in adults, and lower than 5% will progress into chronic hepatitis B. What is chronic hepatitis B? When the hepatitis B virus exists in our body for more than 6 months, it is called chronic hepatitis B. More clinically specific, we use blood tests when hepatitis B surface antigen present in serum for more than 6 months. Clinically, we define it as chronic hepatitis B. How many percentage of people with hepatitis B are symptomatic? Generally speaking, it has something to do with his age and the time he was infected. Generally, more than half of adults, and sometimes as high as 70 or 80% have some symptoms. These symptoms are sometimes non-specific. For example, tiredness, fatigue, wanting to sleep, sometimes combined with some gastrointestinal symptoms, such as nausea and vomiting. Even more serious symptoms of hepatitis will occur, such as jaundice, tea-colored urine. What is the rate that people infected with hepatitis B turn out to be chronic hepatitis B infection? Generally, the age is still an important factor. The younger they are, such as newborns, infants, and children, they are more likely to develop a carrier state when infected with acute hepatitis B. Chronic hepatitis B infection. The symptoms are generally milder, just occasional symptoms of burnout, tiredness, fatigue, nausea, loss of appetite. But the infection looks different in adults. Generally speaking, the symptoms of adults infected with hepatitis B virus will be more obvious and often combined with more serious symptoms. But less than 5% of adults infected with acute hepatitis B develop chronic hepatitis B. How do I know if I am a hepatitis B carrier? They need to go for a health checkup by themselves, because most of the carriers of hepatitis B are asymptomatic. Therefore, if you don't go for a checkup, you don't even know if you have hepatitis B or not. Based on past epidemiological data, only 50% of hepatitis B carriers are aware that they are carriers. This means that nearly half of people do not know they have hepatitis B or not. So going for a test is the best way to know if you are a carrier of chronic hepatitis B. Now, these blood tests are quite simple. In fact, many doctors have a lot of stories about taking care of chronic hepatitis B carriers. Stories like, one carrier never have any symptoms, but developed liver cancer when using the health insurance card for the first time. I had a patient with chronic hepatitis B in recent years. He's a white-collar worker in his 50s. He has been followed up regularly, come to my clinic every 6 months for abdominal ultrasound and blood test. Within a fixed check-in period, we found out that he had hepatocellular carcinoma in very early stage, less than 2 centimeters, and he promptly received a curative operation. After that, we also give him antiviral therapy to control his hepatitis B. Until now, around 3 years passed, and there is no signs of recurrence. He has been living a happy life afterwards. This is quite a different fate. This fate depends if we are really carriers of chronic hepatitis B. It is necessary to do regular follow-up and inspection. Thank you, Dr. Huang, for coming to the Care Online. See you next time. Bye. Bye.